And for the next panelist, I'd like to talk to Dr. Adelina. Uh, and Dr. Adelina is a associate professor in the Department of Family and Community Medicine in the College of Medicine at the University of the Philippines, Manila. She has also been part of many social movements that focus on universal health care and has championed this cause for quite a long time. Uh, Dr. Edeline, you've just heard that from IOM and WHO, this whole question of making services accessible to all and this whole process of gathering of best practices and things like that. Uh, you have yourself been in this campaign calling for universal health care access kind of thing. Where do you see some of this going in the sense of is this coming out of the COVID? Is this going to be something that states will begin to champion? Have we finally gotten to that point where we recognize that, yes, we live in a time where universal healthcare should be mandatory available for all? The floor is yours.
Thank you very much, William. And thank you to the Migrant Forum Asia for this invitation to be part of this very stimulating and interesting discussion on the GCM. So, actually, I've been listening to the previous discussions, and I can really say that the COVID pandemic exposed a lot of weaknesses and gaps in the public health system. And really, what we have been striving for and advocating for in terms of people's right to health um, has been challenged and tested. And here, I'm using the Philippine experience really as something that um, is not very good in that sense, because our experience really did not address much the health measures or the health interventions, because what we had was really a militarist approach. And even for our overseas Filipino workers who came back here, they experienced a lot of discrimination. And because when they came back, they had to be quarantined before they are allowed to go back to their provinces. But the quarantine areas in the city were very, very lacking. And even the areas that were given to them, like the Rizal Memorial Stadium, was not really an adequate place for a quarantine because they were all close to each other. There was no physical distancing. They were not even wearing masks. And the tests that were supposed to have been done for them was not done in the context of free testing. They had to pay for the tests, and the tests was done in private laboratories, and the cost really varied a lot from 3,000 to 15,000. So it's so exorbitant. And a lot of our overseas Filipino workers who already did not get their salaries because, as was mentioned earlier, some of their companies closed down and they were not given the commensurate salary for their work. They did not get it. So they were really asking for the support from government. And for us in the Philippines, the government support was really very lacking. And here I could call on the Universal Healthcare Law, which we passed in 2018, as also not really the law that we hoped it would have been to have provided these services to the people, because our law is being implemented not as a universal healthcare law, but as a universal health coverage law, which means you have to have premium of insurance. And PhilHealth, the Philippine Health Insurance Corporation, was identified as the financing mechanism for making sure that the services under the universal healthcare law or coverage, universal health coverage, was being implemented. So here again, there's a lot of issues at hand because not all the services that were supposed to have been given were paid for, because PhilHealth could only pay so much. And even the overseas Filipino workers were complaining about PhilHealth because they had to pay the premium, which is very which is high, and they're not even benefiting from it because when they get sick, they use the insurance of the countries where they are working in, but they are made to pay a lot of premiums. So even the local people who are being charged are also paying a lot. So universal health care that was supposed to be the venue for making sure that health services would be available to all was not really working as such. So this is really where we have a lot of questions because I hope you, because you cannot just, I'm citing the case of the migrants, the Filipino workers coming back. They, like even the testing, PhilHealth should have paid for that, but it was not paid. So they have to pay for the tests before they're able to go home to their provinces. So it took a lot of time before they were allowed. So we have so many locally stranded individuals who were left in Manila, who got sick because they were actually in areas where there was no physical distancing or they were not even wearing masks. So these are the difficulties that we have if the government does not really provide for the needs of our people. So the universal health care law, as would have been implemented, should have provided for free quality services, comprehensive services, but because it was banking on insurance as the financing mechanism, it did not work because not everybody has PhilHealth. And PhilHealth for now also is being plagued with a lot of corruption issues. They are not able to pay what they are supposed to pay because a lot of the money has been lost to corruption. So I'm sorry, but I don't see UHC as working in the Philippines the way it should be. I don't know how it is in other countries, but even the concept itself that WHO has promoted has been transformed into universal health coverage. And it's now insurance based. So, this is something that I think all of us should include in our advocacy for services, even for the migrants, because we have to go beyond just the issue. And as I mentioned, the COVID-19 pandemic really exposed a lot of weaknesses. And in the Philippines, that means the public health system was not there because we have been banking on privatization of our health services. We have been corporatizing our public hospitals. Our health services have been commercialized. And even the devolution, where I'm happy that Willy's talking about good response by the Naga City, but in many areas of the Philippines, devolution has not really worked because some local government officials do not know how to address health. And the DOH has not really made its mark to all the local governments because they keep saying, oh, it's devolved to local government. So this is where we see the need again of the national government taking the responsibility. And maybe this is something that are part of the neoliberal policies that our government is following. Privatization, devolution, budget cuts. Budgets have been cut and they expect private donors to contribute when it should be the public, the government that should really prioritize this. And I think long before COVID, neoliberal policies have been our problem in the economic policies that we have. And it was really shown hard. It was very, very evident in this time of pandemic.
And thank you, and thank you for that. And I think you've raised a very key point here, and which would be interesting. And I'd like to see how Poonam and June will actually respond to this as well. You have raised a big point in terms of public health services and how broken it is. And let's just say that it is broken in quite many parts of the world, kind of thing. It's not only in the Philippines that we have seen this story repeat itself, kind of thing. And so even when we talk about services in Objective 15, and we heard June talk about how they've expanded Objective 15, the working group expanded its from 5 priority areas to 10 kind of priority areas. So health, housing, water, and things like that. Somebody's got to pay for all of this at the end of the day. for all these services, somebody's got to pay for it, and you're making a strong case for government to play that role. But we have, and we know that health services, a large part is gone corporatized kind of thing and reliant on insurance schemes. So what are you seeing therefore then coming out of this, uh, in terms of how do we go about propping up once again public health services? What would it require?
Well, I see that the health department should really be on top of this. Unlike what we have in the Philippines now, the one in charge of our COVID response is the military. And so it should be a health response, not a militarist response. And here also, we're saying that there is the money. So we don't, it's not that like people are saying, oh, do not go for a free lunch or nothing is free. What we're saying here is people are paying taxes, and therefore the taxes have to be reverted back as a service. Even our poor are paying taxes because we have the value added tax or the VAT, and everything that we buy has a VAT imposed. Every service that is given to us has a VAT imposed. And so all of us are paying taxes, and we expect that the government should prioritize social services more than the infrastructure, more than the build that they're doing now. And I think it's the same in other countries also, that if you use your taxes correctly, then you will be able to provide for what your country needs. I know the experience of Vietnam. At the start of the pandemic, they immediately did mass testing for free. They provided the services for free, and they were able to control their pandemic. They locked down their borders. It was a government political will. And that's what is missing with our experience, because they put a lot of focus on what will foreign investors say, what will other people say, how about the foreign income that's coming in, focusing on what foreign investors are going to put rather than what my people need. So I think this is where uh, political will comes in, and where taxes should support the health system, not insurance. And this can be done. I believe it can. You're muted, William. I can't hear you.
Thank you for that. And I'll come back to you. But when I come back to you, I'd like you to think about this. Is then in terms of Objective 15, this whole lineup of services that Objective 15 has, uh, in many ways to deliver it, it will have to be the governments. According to what you say, the government would have to cough up the resources for this. So then, in terms of the UN advocating for this, what would be the link between the UN kind of an advocacy for it? What would be required in terms of moving governments to take this agenda on? Simply, and I'm sure you would agree, simply putting it in a document and saying this is what the world should look like is not going to happen. So what role can the GCM objectives, UN agencies play in making this happen? I'll ask you to think about that and come back as I move on